Hey guys, tonight on Margaret Radio, Health in Later Life, we're settling into something important, something that might seem small at first glance but deserves your full, quiet attention. You're lying down. The day is done, or close enough. Maybe the dishes are drying on the rack. Maybe your favorite slippers are nudged just under the edge of your bed. You feel that soft exhale after a long stretch. Your shoulders sink a little lower, your jaw unclenches. And that's perfect, because tonight we're gently easing into the story of how simple, persistent fatigue, yes, that bone-deep tiredness, can actually be an early signal from your heart. Now, don't worry. This isn't going to be one of those late-night spirals where a random symptom sends you diving into the depths of the internet, convinced you're falling apart. We've all been there. 1 minute, you're yawning a little more than usual. The next, you're wondering if it's something serious or just the third cup of coffee rebelling. It's okay. You're not alone in that. What we're going to do instead is gently explore how your body whispers. It doesn't always shout. And when it comes to heart health, especially as we move into the later chapters of life, it's the soft signs, the slowdowns, the sleepy afternoons, the why am I still tired after 8 hours kind of questions that can carry the most meaning. So if you've ever felt like your energy just leaks away by midday, or like getting out of a chair takes more thought than it used to, tonight's story is especially for you. We're going to slow walk through what that kind of fatigue might mean, not in a scary way, but in a wise, understanding way. You see, your body has its own language, and one of the earliest ways it tries to get your attention, long before anything serious happens, is by dialing down your energy. That might seem like something small, but when you listen with kindness, it can be one of the most powerful forms of prevention. So before you get comfortable, take a moment to like the video and subscribe, but only if you genuinely enjoy what I do here. And if you're feeling cozy already, I'd love it if you dropped a comment below and let me know where you're watching from and what time it is in your little corner of the world. Whether it's 10:12 p.m. in Michigan or a sleepy 3:40 a.m. in Cornwall, this space is just as much yours as it is mine. Now, dim the lights, maybe turn on a fan for that soft background hum, and let's ease into tonight's journey together. You might not even notice it at first. That gentle tug behind your eyelids, the way your limbs feel just a little heavier than usual. Maybe you wake up feeling like you never fully powered off. The kind of tired that doesn't scream, but murmurs. Low and constant, like the hum of a fridge in the next room. At first, you chalk it up to age, or a poor night's sleep. Maybe you blame the weather, or the grandkids, or the cat waking you up with those 5 a.m. zoomies. And fair enough, all of those can play a role. But every now and then, that slow exhaustion has a deeper root. And for some people, especially those in their later years, it's the heart quietly asking for attention. That kind of tiredness isn't dramatic. It doesn't always come with chest pain or shortness of breath. It's sneakier than that. A little like how you forget a word here and there. Not enough to panic, just enough to notice. And when your heart has to work harder than it should, when blood flow slows, or when parts of the heart aren't getting enough oxygen, it can make you feel like you're carrying an invisible weight all day long, a weariness that no amount of naps seems to shake. Still, it's not your fault for not spotting it. You've been told for years that heart attacks come suddenly with sharp pain or a dramatic fall. But for many, especially women and older adults, the story looks different. It begins with the simple things. Walking a little slower, feeling drained after climbing the stairs, or needing to rest more often than before. It's okay if that sounds familiar. Tonight, we're going to make sense of it together, not with urgency, but with understanding. We're going to walk slowly through the whispers of your body and learn how to gently listen, to spot the signs that often go overlooked, to feel a little more in tune with the quiet parts of you that keep you going, day after day. So rest easy. You don't need to diagnose anything right now. You don't need to fix anything. All you need to do is listen, softly, gently, and let your heart's story unfold. You begin to notice the little things first. Maybe you used to take the stairs without thinking, 2 at a time on a good day, but now even one flight feels like a gentle uphill battle. Or you realize that by mid-morning, you're already wondering when it'll be acceptable to have a nap. It's not dramatic, it's quiet, and that's what makes it so easy to miss. Fatigue, the kind that lingers and tugs at your day, is one of the most overlooked early symptoms of a heart attack, especially in older adults. It doesn't come with flashing lights or sharp pains. It comes like fog, slowly, subtly, and stubbornly. You might assume it's just the weight of age or a few nights of interrupted sleep, and sometimes it is. But sometimes it's your body trying to say, hey, something's not quite right. Let's unravel that gently. Your heart is a tireless worker. It beats around 100,000 times a day, pumping blood, delivering oxygen, making sure every corner of your body stays nourished and ready to go. But just like any system that's overworked or undersupplied, it can struggle quietly. And when it does, one of the first things to go is your energy. One well-established health fact is this: when your heart isn't pumping efficiently, say, due to narrowed arteries or an oxygen-starved muscle, you're likely to feel drained. Your muscles aren't getting the fuel they need, so your body shifts into a low-power mode, like a phone with 10% battery left. It wants to conserve. It wants you to slow down. This kind of tiredness doesn't always make sense. You may get a full night's sleep and still wake up feeling like you didn't rest. You may take your usual walk and feel oddly winded halfway through. The fatigue might even creep in while you're sitting still, folding laundry, reading, watching a favorite show. And it's not about laziness, weakness, or just being out of shape. It's a clue, waiting patiently for your attention. The causes behind this fatigue can be as layered and gentle as the fatigue itself. One major cause is reduced oxygen supply to the muscles and brain. If the heart's blood vessels are narrowed due to plaque, a process called atherosclerosis, then oxygen has a harder time reaching your tissues. The result? Your body compensates, and you feel the slowdown. You might also notice your appetite isn't quite the same. Maybe food doesn't appeal the way it used to. That's because the digestive system, another high-demand area for oxygen, can get sidelined when your body shifts into heart preservation mode. Eating itself might make you tired. Preparing food may feel like a chore. Even that beloved morning tea might lose a bit of its usual sparkle. Another cause is inflammation. When your body is inflamed, especially in response to hidden heart strain, it diverts energy to deal with the stress. This isn't the type of inflammation you can see or feel directly. It's internal, cellular. It's like your immune system is always slightly on edge, and that can drain your reserves. That's why, even before anything dramatic happens, you may already feel like you're operating on fumes. Hormonal shifts play a role too. Your stress hormones like cortisol might be elevated if your heart's under pressure. And that chronic hum of stress, even if you don't feel stressed out, can interfere with your sleep, digestion, and recovery. It's like trying to drive with the emergency brake on. You're moving, but it's harder than it should be. For women, especially in their 50s, 60s, and beyond, fatigue is often the primary heart attack symptom. Not chest pain, not shortness of breath, just tiredness. This is one of the reasons why heart disease is so often missed in women. It doesn't always fit the textbook picture. And yet, here's something comforting. Your body is so much wiser than you might think. It sends you messages, even softly. And one practical, lesser-known insight is this: if you keep a fatigue journal, just a small note each day about your energy levels, sleep quality, and physical effort, it can help you and your healthcare provider spot subtle patterns. Over time, those patterns can tell a story your blood pressure monitor alone never could. There are other questions too, ones that don't have a single answer. Why do I feel okay one day and exhausted the next? Why does climbing stairs make me sweat more than usual? Why does my heart beat just a little faster than it used to when I'm only folding towels? These are common experiences. You're not imagining things. You're not being dramatic. You're being wise enough to notice, to pay attention. Another piece of the puzzle: anemia. When your red blood cell count is low, oxygen delivery drops, just like with heart issues. And guess what? Older adults often deal with both at once. So that tiredness, it might be a duet between your heart and your blood. Nothing frightening, just something to observe and explore. Even medications can whisper into this fatigue. If you're on beta blockers, for example, which are often prescribed after a heart condition, they can slow your heart rate to keep it calm. But for some people, especially in the early days, that calm feels like lethargy. You're safe, but you're slow. Again, it's not failure, it's adjustment. And sometimes, just sometimes, it's not the heart directly at all, but the lifestyle that affects it. You might be sleeping too lightly, eating less than you think, or not drinking quite enough water. Dehydration in older adults can be surprisingly sneaky. It doesn't always show up as thirst. It shows up as low energy, dizziness, or even confusion. But remember, fatigue that ties back to heart issues tends to linger. It's not just one off day. It's a gentle decline. A sense that you're fading out by noon and dragging your feet by sunset. Still, here's the reassuring part. This kind of tiredness isn't irreversible. It's not your body giving up. It's your body tapping the brakes, giving you time to notice, to care, to act gently and early. And you're noticing tonight, that matters more than you know. So now you know, your fatigue may not just be about sleep, age, or the weight of everyday life. It might be your heart asking you to take a breath, slow down, and listen. And the good news, there are gentle, meaningful ways to respond. You don't have to overhaul your life. You don't need to leap into exercise plans or overhaul your diet overnight. All you need is a calm, steady shift, a conversation with your body that says, I hear you, I'm here. Let's begin with the simplest, most loving step, acknowledgement. When you stop dismissing your tiredness as just getting older, you open a door. And once that door is open, we can step through together. The first solution isn't really a solution at all. It's a gentle practice, daily awareness. Just taking a moment in the morning and again at night to ask, how do I feel today? Not in a panicked way, but in a curious, kind way. Energy is personal. What drains one person might energize another. You know your body better than anyone else, so become your own gentle observer. Maybe you begin to notice that certain foods weigh you down, or that a midday walk revives you. Maybe, like clockwork, your energy dips right after lunch. These are not coincidences. They're cues, and you can build your strategy from them. Let's talk about movement, not exercise, just movement. When your heart is struggling, the last thing it wants is strain. But it does want rhythm, flow. A short walk after meals, just 5 or 10 minutes, can work wonders. It stimulates circulation, boosts oxygen delivery, and helps you feel more alert. One well-established fact is that even modest movement improves cardiovascular efficiency and reduces inflammation over time. You don't have to walk far. You don't need perfect shoes or a step counter. Just walk to the mailbox, or down the hall, or around the kitchen island while waiting for the kettle to boil. The goal is consistency, not effort. Now, here's a comforting tip you might not hear often. You can rest on purpose. That means scheduling breaks even when you don't feel tired. This may sound odd, but it teaches your body that rest is allowed, that it doesn't have to manufacture a symptom to earn a pause. Sit by a window, breathe deeply for a few minutes. Lie flat on the bed and look at the ceiling with no plan. This isn't laziness, it's renewal. Let's talk about sleep. You might think, I sleep plenty and still feel exhausted, but sleep quality matters more than quantity. If your sleep is fragmented by bathroom trips, anxious thoughts, or shallow breathing, it's not doing the job your body needs it to do. Simple changes like raising your head slightly with an extra pillow or using a white noise machine can help. Even avoiding screens for 30 minutes before bed can improve the depth of your sleep. And if you're snoring loudly or gasping in your sleep, things you may not notice, but a partner might, it could be sleep apnea, a condition that increases the heart's workload and leaves you feeling drained. It's worth asking about. There's no shame in checking. Sleep studies these days are often done at home, quietly, comfortably. Here's another practical insight that's often overlooked. Check your hydration. Even mild dehydration in older adults can mimic heart-related fatigue. A drop in fluids thickens your blood, makes your heart work harder, and slows down circulation. Aim for consistent sips throughout the day, rather than large glasses all at once. Herbal teas, broths, even water-rich foods like cucumbers or melon all count. Your heart loves a well-hydrated environment. Food matters, of course. But again, we're not here to overhaul, just to tune in. Focus on heart-nourishing choices. Oats, berries, leafy greens, beans, a bit of olive oil. These foods support blood flow, reduce inflammation, and provide steady energy. Try having something small every few hours to keep your blood sugar even. A handful of almonds, a slice of toast with avocado, some yogurt with fruit. Fatigue can spike when your blood sugar crashes. One gentle ritual that many people find helpful is a warm foot soak before bed. Not only does it relax your muscles, but the heat dilates blood vessels and encourages circulation throughout the body. Add a handful of Epsom salts, and you've got magnesium, a mineral that supports both sleep and heart rhythm. Sometimes, the smallest acts have the biggest return. Now, let's take a breath and talk about stress. Even if you don't feel anxious, chronic low-grade stress taxes your heart. It raises blood pressure, tightens vessels, and exhausts your system. But you don't need to meditate on a mountaintop to help your body recover. Just 5 slow breaths, in through the nose and out through the mouth, can bring your nervous system back into balance. Or try journaling. A few quiet lines each night about your day, your body, or what brought you peace. Writing gives your mind a place to rest, and over time, it helps clarify what's helping and what's draining you. One of the most healing tools you can give yourself is community. Fatigue loves isolation. It thrives in silence. So talking, gently, casually, even with a trusted friend or neighbor, can lessen its grip. You might say, "I've been feeling more tired than usual lately." That's it. And you'd be surprised how often someone says, "Me too." Now, when should you check in with a doctor? You don't have to wait for pain. If your tiredness is new, persistent, or interfering with your normal activities, it's worth discussing, especially if it comes with other subtle signs: mild shortness of breath, lightheadedness, or a heart that feels like it's fluttering or racing at odd times. There's strength in seeking clarity, not panic, not urgency, just clarity. And if you feel dismissed, ask again, or find someone else. Your story deserves to be heard, even if it doesn't sound textbook. You're not here to fit into a chart. You're here to feel better. And there are doctors, nurses, and care teams who will listen. Keep looking until you find them. Sometimes the solution is as small as adjusting a medication dose, or treating an underactive thyroid, or adding iron, or just being reassured that yes, your heart is fine, and this fatigue is fixable. And sometimes it's a wake-up call, a gentle one, the kind that says it's time to care for yourself the way you've cared for others your whole life. So let this be a new beginning. Let your fatigue be the reason you stretch a little each morning, or drink a glass of water before your first cup of tea, or go outside and feel the breeze on your face for 5 uninterrupted minutes. You don't need energy to start. You just need curiosity. You just need love for the body that carries you through the world, tired or not, strong or soft, fast or slow. And here's a final comforting thought. Your heart wants to heal. It's designed to recover, to adapt, to grow stronger. You're not behind. You're right on time. This story isn't ending. It's opening. There's something almost poetic about noticing your fatigue. Not fighting it, not fearing it, just recognizing it for what it is. A soft knock at the door. A whisper from your heart saying, something could be better. Let's find a gentler way to carry on. So now as you settle deeper into your chair, or your bed, or wherever you've chosen to unwind tonight, let's bring the pace down just a little more. Let's wrap ourselves in the warmth of understanding. You've come a long way just by listening, just by being here. You might still be tired. That's okay. But now that tiredness has a shape, a story, a meaning. It's not just some fog you have to push through. It's a message, and you've learned how to read it. Maybe tomorrow, when you wake, you'll stretch just a little more gently. Maybe you'll notice your breath or sip your water more slowly. Maybe you'll hear a bird outside or catch your reflection in the window and think, this is my time. My health is worth honoring. You've done something remarkable tonight. You've chosen to tune into your body with kindness, not suspicion, not frustration, just care. You've explored the connections between fatigue and heart health, between feeling drained and staying safe. And in doing that, you've already made a change. It doesn't matter if your energy doesn't return all at once. This isn't a race. It's not a countdown to some perfect version of yourself. It's a practice, a peaceful one. Some days will feel better than others. Some nights, you might still feel unsure. But now, you know what to look for. You know how to respond. You know that persistent fatigue can be an early sign of something deeper. And you also know that small steps, a walk, a breath, a check-in, a question, can gently nudge things back into balance. So as you drift now, maybe with the fan humming softly in the corner or the night sounds outside your window, let that thought stay with you. Your body is on your side. It doesn't speak in riddles. It speaks in patterns, in signals, in gentle nudges. And all it asks is that you notice. No need to fix everything tonight. Just rest. Let your breath soften. Let your eyelids grow heavier. Let the story of your body continue unfolding, gently, slowly, with care. And when morning comes, when the sunlight filters through the curtains or the birds begin to stir, remember this moment of stillness, this tiny promise you made to yourself, that you'll pay attention, that you'll move kindly, that you'll ask questions, that you'll listen. Let your sleep tonight be easy. Let your dreams be kind. You are not alone in this journey. There are many walking this quiet path, just like you, learning, noticing, caring for their hearts, not with fear, but with understanding. And that's where healing begins. Take another breath, hold it, and let it go. You're doing just fine. Sleep well, friend. Sleep well.